What's up, everybody? Matty Willz tapping back in for yet another episode of Wellbeing Wednesdays with Matty Willz. Of course, brought to you by the fine folks over at MetroHealth, where each episode we speak to a different well-being expert, mental health professional, all of the above, about everything under the sun. And that's exactly what we'll do today. So without further ado, we'll bring in today's interviewee, the one and only Amy Lowell. And she is obviously with MetroHealth. That's why she's here. And first and foremost, hi, thank you so much for taking some time out of your day to speak with us.
Hi, thank you for having me.
Absolutely. So everybody that you work with and yourself and everyone over there, you guys have these illustrious titles that I know you went to school for a very long time to achieve. So I'd just like for you to kind of share some of your story with our audience real quick so they can get accustomed to who you are.
Sure. So I have always been interested in birth and women's health. As I was getting my education, I decided that I wanted to be a registered nurse and thought I wanted to be a labor and delivery nurse and help women bring their babies into the world and expand their families. Through my time working as a labor and delivery nurse, I decided that midwifery was for me. So I went back to school, got my master's degree in midwifery, and for the last 28 plus years have been delivering babies everywhere from New York City to Hawaii. And I'm glad to say that I returned back to Cleveland, where I grew up, and helped the women of Cuyahoga County welcome their babies to their family.
And so that makes you a perfect candidate to speak with us about today's topic, which of course is MetroHealth's midwifery program. And I'm glad you said that word first, because I surely would have mispronounced it based on what I was reading. But so thank you for doing that. But so we'll just kind of hop right in. So what is a midwife and how do they differ from an OBGYN?
Yes. So just as I had mentioned, to be a certified nurse midwife, you need to be a registered nurse at first. And then what the job requires is to have an advanced degree, more training in women's health. So that is either a master's degree or a doctorate degree in midwifery. And how it differs from an OBGYN is we are not medical doctors. We did not go to medical school. The focus of our practice is really on healthy women. We don't necessarily look at the disease, we look at the person. So not just that pregnancy or their GYN care, but how their families interact and affect this, their psychosocial criteria. We really look at the person and try to help them and manage them through their pregnancy or their healthcare by looking not just at the medical condition.
Got you. So a touch of the human side of it, if you will. So who qualifies for care through a midwife?
So as I mentioned, we focus on healthy. I would say anybody who has very low risk medical factors, overall healthy, someone who is not managed with any comorbidities such as pre-existing diabetes that is on insulin or autoimmune disorders. We actually have guidelines that we follow so that the care is consistent amongst provider to provider. But anybody who's possibly seeking a little bit more than the medical avenue that wants to focus on education, really take control of their pregnancy and like I said, outside of the pregnancy, because we do take care of women who are not pregnant. And I think that's a myth that if we are a midwife, we tend to not medicate our patients. That's absolutely not true. We tend to only take care of pregnant patients. We take care of women from adolescence all the way through to postmenopause, really through the lifespan. So there are a lot of misconceptions, and overall, I would say about 80% of the population would qualify for midwifery care.
Wow, you just cleared up a couple of misconceptions that I had just in the last 10 seconds there. I wasn't aware of that. And I'm sure a lot of our audience isn't aware of that either. So obviously, before we get to the last question, you guys are very important. Just a couple of numbers that I thought were interesting that your staff shared with us. 1 in 9 babies were born preterm in Ohio in 2022. And then in addition to that, 79.5% of infants were born to women receiving inadequate prenatal care. So kind of some startling numbers there. How does MetroHealth's midwifery program benefit patients?
That's the goal here, right? We're trying to turn this around. Well, for starters, more access to care. There's providers that women can get in with. More providers means more access to care. We need to make sure that our community is not afraid to go to the doctor. And this is a tricky one because I think for some individuals, they are afraid to go to the doctor or might feel judged or feel a disconnect. And that's a generalization. So I want to be careful to say that that's not the whole medical system. But for some reason, midwifery seems a little bit more hands-on, not as, we get a lot of women who have white coat syndrome because they come in and they get nervous to talk to the doctor. So I want to be careful about using the word approachable, but I think it's a little less threatening for some individuals. So when we can get women into care, we know we can do better, right? We can pick up problems. We can develop a relationship, hopefully deliver trust with the families. We include the whole family. And when you build the trust, patients can start to navigate the healthcare system and make their own decisions and not feel that they're talked to, but jointly work through their healthcare. And it actually does improve outcomes. Other things that we're going to do at MetroHealth that I think are going to promote better outcomes are group prenatal classes. This is called Centering Pregnancy. We know we have the data to show that it improves outcomes, decreases the chances of having a baby born before their full term. So these are group prenatal classes where a woman is placed in a class with someone who has a similar due date. We welcome their support people to come, whether that's a parent, an auntie, a best friend, the father of the baby. And we talk about really important issues that maybe aren't able to be spoken to about in a prenatal visit. We know doctor visits are 15 minutes. So we talk about common discomforts in pregnancies, what to worry about, what not to worry about. We talk about labor signs and symptoms, when to go to the hospital, the pain medications that are offered to our patients so they can make the best choice for them and be educated about it. We talk about postpartum care, which includes newborn care, breastfeeding, and then also mental health, because I think everybody assumes having a baby is this joyous occasion, which for most women it is, but it's also filled with ups and downs. And there's a lot of stressors in our community today. And adding on a baby to that can really be very overwhelming to a new family.
Absolutely, absolutely. She's Amy Lowell with MetroHealth. Today we're discussing MetroHealth's midwifery program. I'm Matty Willz with Radio 1. And before we get out of here, I just want to remind everyone to learn more or to schedule an appointment with a certified nurse midwife. Please call 216-778-4444 or visit metrohealth.org/midwife. Now, that's still midwife, or am I supposed to say midwife? I'm not supposed to say.
Yes, you didn't. No,
okay.
It's midwife and midwifery. Very good.
Okay, just making sure. But yeah, again, thank you so much for taking some time out of your day. This information is very important. And if you're watching this and you feel like you know someone in your circle, a family member, a friend, or whoever, feel free to share this video with them, because all we're trying to do is. Amy said something that spoke to me when you said trust and people's mistrust and the approachability for people when they don't necessarily trust certain people in the medical industry, or for whatever reason, or just I know for myself, and I've never been obviously in this situation, but it was just kind of like a fear of going to the doctor a couple of years ago. And I think conversations like these help some people overcome those fears, because it humanizes everything and it shows just how important it actually is. So thank you for that.
You're welcome. Can I just say one thing? I do like
Absolutely.
with my own patients to really start off when I haven't met them, to know that it's a relationship, and my job is to give them factual information so that they can make the best decisions for them. And you can almost see the patients kind of relaxing because they feel less judgment and they can be honest, and we can navigate together so that the best outcomes can happen. And I think when you have a conversation, it'll help the patients come back.
Perfectly said. And there's no better out than what you just said. So I'll just leave it at that. So thank you so much for your time. And hopefully we'll talk real soon. Okay.
Thank you so much for having me.
Absolutely. This was another episode of Wellbeing Wednesday with Matty Willz, brought to you by MetroHealth. We'll talk soon. Thanks.